had no clue that nursing went that far.
It doesn't matter if it's COVID, if it's TB, whatever it is, we have to do it. This is what we signed up for. Hi guys, today we're going to talk about some things myself, Itasca.
I'm Fern.
Some things we wish we would have known before becoming a nurse.
I mean, it's a lot of different, facets to nursing. A lot of different things that go with it that I didn't know in the beginning.
So many things we learned as we grew through healthcare. Some things I guess I would say would be first my education path. I guess thing I wish I should have looked up on. I wouldn't have took so long, I guess.
Yeah.
So long to complete my degree. I would have just continued.
I didn't even know that it was like a nursing career path when I first started. I didn't know that you could be an STNA, then you could be an LPN, and then you could be an RN. It's actually kind of cool. You do 2 weeks STNA, a year to be an LPN, and you come out making really good money. Then you go ahead and finish up and get that degree. You can do an associate's degree, do your bachelor's. Like, you can start off as an STNA and end up being like a doctor. Literally, and you see your patients in the hospital or in the doctor's office, and you're the nurse practitioner. Like, that holds a lot of weight, and I just wish I would have knew that. I mean, because then I could have did it a little faster, just like Tassi said.
Well, yeah, I guess I knew that part.
Yeah, you knew that. I didn't.
I did, because I started off as an STNA. So I think that being an STNA was really beneficial for me because I was able to provide that bedside care. And as I grew into management, I still understand every level of nursing.
Yeah. I didn't know the nursing assistant part. I mean, once I became an LPN and I was working on the floor, I kind of knew, I'm like, whoa, I need my nursing assistants. Like, I need us to be a good team. I need them to trust me. I need to trust them. So I developed that relationship, and I kind of knew that I had to get hands-on to get that. But I always think, like, back to the nurses that were nursing assistants, they know how to do everything. Like, I was a nurse, like, I don't know how to do this bedpan. What am I supposed to do? They were, like, good. And I just think back, like, dang, I should have started a little sooner,
I guess also another thing we could talk about is our interaction. People don't understand. Nurses have a lot of responsibility. Nursing assistants basically they provide all the care. They're right there. They're hands-on. Actually, they're the first person the family, the resident, the patient interacts with. But as you work the floor, you come to understanding more that a lot of responsibility is on the nurse. So a lot of people think, my doctor, not to, talk about doctors or physician assistants, nurse practitioners. The nurses are actually doing a lot of the work. Mm-hmm. So today, as we face this pandemic, it's a lot of your nurses frontline. And we see a lot of interaction on social media, on the news. And to me, when I hear nurses say, this is not what I signed up for, or I'm not going to work there no more. At the end of the day, we're here to provide a service. We're here to take care of our residents and our patients. This is what we do. It doesn't matter if it's COVID, if it's TB, whatever it is, we have to do it. This is what we signed up for. We signed up to provide a service and to take care of every individual.
Yeah, no matter what the money pay is or anything like that, everybody's glorifying it now because it's a pandemic. But really, when you're in that situation, when you have these people that are sick or suffering and families can't see their loved ones, we're the ones that's making those FaceTime calls happen. We're the ones that's putting ourselves at risk, putting our families at risk just to provide a service for these people. And we do it because we care. It's a lot of gratification in the end of the day. When you see those people happy to see their loved ones after not seeing them for a long period of time, or just being nice, giving them conversation. It's a lot of stuff that you do outside of nursing that has nothing to do with IVs, blood draws, medicine, any of that.
Right, vital signs.
None of that.
It's just really
being a
caring.
good person.
Yeah, caring.
And being very caring. And that's why we did the whole bring the caring back to healthcare. Because so many times families, patients, they're like, oh my God, you're so compassionate, you care, thanks for talking to me. That's what it's about at the end of the day. When you're sick and you're down and you don't know if you're going to make it, you don't know if you're going to make it through this little session or whatever it is that you're dealing with at that time, having somebody that cares, that's taking care of you,
it takes away from whatever diagnosis you're facing. Someone to walk in and put that smile on your face, not focus on the task, it changed the resident, patient, individual, whole mood. So let's talk about firsthand health careers. This is exactly why we started it. So our individuals that come through that door, they first gonna understand why you're doing it. Not just to make your money, but to also care, love what you do.
Yeah, because even though you're making the money, you're still on the front line. So, not saying that it's not a good career path. It's an awesome career path. During this time, we still have jobs. The money is abundant right now. We have opportunities that's coming to us abundantly because we're in healthcare. So not taking away from that at all, but remembering that we're there for the people. We're there to service these people, take care of them, be that voice of reason, that compassionate person for them.
Be that advocate for your patient.
So you want to be a nurse. We kind of gave you a little breakdown of what our experiences have been. Everybody's experience is different, but we do encourage you to start here at First Hands Health Careers.
We're always here. You're going to walk in this door, you're going to finish as an SCNA, and we're going to guide you to further your career. FirstHandsHealthCareers.com. Follow us on Instagram.
Like us on Facebook.
Thank you guys.
Thank you.
Subscribe to our channel at First Hands Health Careers on YouTube. Thumbs up, no thumbs down.